thoracic cavity in between the right and left lung. It lies within the middle mediastinum. As we already know, there is a superior mediastinum and inferior mediastinum. The inferior mediastinum is further divided into the anterior, middle and posterior mediastinum. So heart lies within the middle mediastinum and it rests upon the diaphragm. Heart is composed of 4 chambers, like 2 atria and 2 ventricles. This is the left atrium and left ventricle. Similarly, on the right side, there is a right atrium and right ventricle. So there are 4 chambers within the heart and 4 valves. There are 2 atrioventricular valves in between 2 atria and ventricles, and 1 pulmonary and aortic valves. So these are actually opening within the heart. Like we can see, this is the left atrium and left ventricle. So left atrium will pour its blood to the left ventricle via this opening. So this opening is called as a atrioventricular opening. This is the left atrioventricular opening, and there is also right AV opening. So these openings are guarded by this fibrous ring that is called as a cardiac skeleton. Because the heart is a muscular pump, you can see this is the dilated vessel and this is the muscular pump. So maintain its like a shape and patency. To ensure it is patterned and it maintain its shape, they are guarded by a fibrous ring to keep this opening patterned and constant in shape and size. So because these are the muscular pump, if the pressure in the atria is greater, they can get larger or they can get smaller, or gush of the blood can go directly into the ventricle. So that is why they are guarded by the fibrous ring. So these are the fibrous rings which surrounds these openings, and then these openings are surrounded, when they are openings, are surrounded by a ring, fibrous ring, and then there are leaflets are attached to it. Like these are the 2 leaflets, 1 and 2. There are 3 leaflets on the right side. So this is the tricuspid, there are 3 cusps, and this is the bicuspid, there are 2 cusps. So the leaflets are attached to the wall, and then these leaflets can get closed and open whenever they are required. Accordingly, we will discuss when we will discuss the mitral and aortic or pulmonary valves. And they are also attached with the chorda tendineae and then muscles. But we will discuss each and every in detail. This is the superior view of the heart, in which the atria are removed. These atria, right and left atria, are removed. So we can see all the valves at the almost same level. So this is the confusion, why we are seeing all the valve at the same level, because it should be on the different places. So we will see how they are at the same level. You can see this is the lateral view, in which again the atria are removed, but these are the ventricle. This is the right ventricle and this is left ventricle. So these are 2 atrioventricular valves in between 2 atria and 2 ventricles. So this is the fibrous ring, and down are the leaflets. So this is the cardiac skeleton, and this is pulmonary and aortic valve. Now again I'll show you. Now you can see there the atria and ventricles are present also, and pulmonary trunk and aorta is also present, plus all the ventricles. So all chambers and major vessels are visible in this diagram. Now you can see this is the right AV valve, this is the left AV valve, this is the pulmonary valve, and behind at this almost same level, this aorta, there will be the aortic valve. So if you see the superior view, you can see all the valve at the almost similar level or at the same level. So that is the reason if we see the superior view, we can see all the valves like this. Now this is the heart external view. This is the right atrium, right ventricle. So right AV valve will be here, left AV valve will be here. Here will be the pulmonary valve, behind will be the aortic valve. So you can see all the valves are at the same level. Now again this is open view. This is the left AV valve, this is the right AV valve, this is the pulmonary valve, and this is the aortic valve. These are the ventricles and these are the atria. Right atrium, left ventricle, right ventricle, interventricular septum, and these are the valves. Fibrous ring and then leaflets, but these valves does not have like a chorda tendineae and all. Learning objectives. At the end of this lesson, students should be able to describe anatomical position of heart, describe chambers and valves of the heart, traces flow of the blood through the chambers and valve on the left side of the heart, discuss internal feature of the chambers and valves of the left side of the heart. So today actually we are focused on the left side of the heart because this is part 2, and in part 1 you have discussed right side of the heart. Anatomical position of the heart. As you can see, it is situated in between two lungs within the thoracic cavity in the middle mediastinum and rests on the diaphragm. This is the position of the heart within the human body, within the thoracic cavity, and this is how it is obliquely slightly towards the left side. It is situated within the middle mediastinum in between two lungs. Again, this is more clear view, resting on the diaphragm in between two lungs, slightly obliquely and towards the left side. This is the posterior mediastinum, this is the anterior mediastinum, this is the middle mediastinum. So this heart is situated within the middle mediastinum. This is superior mediastinum. This all is the inferior mediastinum. The inferior mediastinum is divided into the posterior, middle and anterior mediastinum. So this part is the anterior mediastinum, this part is the middle mediastinum, and this part is the posterior mediastinum. Now this is the cut section. You can see right and left lung, and this is the heart. This is the pericardium or mediastinum, and this whole is the thoracic cavity. This is the anterior view, this is the posterior view. These are the lobes of the lungs. This is the left lung, this is the right lung, and this is the pericardial cavity in which you can see the right and left ventricles of the heart. Now again you can see this is the diaphragm, this is the diaphragmatic surface of the heart, this is the right border of the heart, this is the left border of the heart, this is the anterior surface of the heart, this is the inferior vena cava, superior vena cava, and this is the ascending aorta and then arch of aorta, and this is the pulmonary trunk, this is the right atrium, right ventricle, this is the left atrium, this is the left ventricle. The left ventricle more towards the inferior surface and then towards the left side. This whole anterior surface is predominantly occupied by the right ventricle. This whole is the right ventricle up till here. This is the right ventricle. This is the right atrium. This is the right auricle. This is the left auricle. This is the left atrium, and this is the left ventricle from here. And then inferiorly diaphragmatic surface, this area is mainly is the left ventricle, and this area is the right ventricle, this region. If I draw a line, you can see this is the right ventricle and this is the left ventricle. In this way. So this is more towards the left and posterior inferiorly, and this is towards the right side. So diaphragmatic surface is mainly found by the left ventricle, and inferior border is found by these both. Now we have Now, chambers and valves of the heart. As we already know, the heart is composed of 4 chambers and 4 valves. This is the right atrium, right ventricle, left atrium, left ventricle. The left atrium is connected with the left ventricle via this left AV valve, whereas the right atrium is connected with the right ventricle via this right AV valve. And this is the pulmonary valve, and behind at this region, this is the aortic valve, this one, which will open within the open into the ascending aorta. So right atrium, right atrium, right ventricle, left atrium, and left ventricle. Valves, there are 2 types of valves, the atrioventricular valves and semilunar valves. The atrioventricular valves are the tricuspid and bicuspid. The tricuspid valve is the right AV valve. The bicuspid valve is the left AV valve. Bicuspid valve, it is called so because it is a 2 leaflet or 2 cusps, and tricuspid valve has a 3 cusp or 3 leaflet. That is why it is called as a tricuspid valve. And there are semilunar valve, which are pulmonary and aortic valve. The semilunar valve are the aortic and pulmonary valve. As you can see, they does not contain the leaflets, or there are no chorda tendineae, no papillary muscles. So these are only valves with these are semilunar valves. As you can see, they are tricuspid. Both of them are the tricuspid. So the pulmonary, aortic, and right AV are the tricuspid, whereas the left AV valve is the bicuspid valve. So we have 2 types of valve, AV valves and semilunar valves. The AV valves is the right and left AV valve, which is bicuspid and tricuspid. The bicuspid valve is situated on the left side, which is most commonly known as a mitral valve. The tricuspid valve is situated on the right side, where the pulmonary and aortic valve are the semilunar. Now, flow of the blood through the chambers and valve on the left side of the heart. So we are more discussing the left side of the heart. As we already know, the right side of the heart receives the blood from 3 sources: superior vena cava, inferior vena cava, and coronary sinus. The superior vena cava, which drains the blood of the head and neck and upper limb, whereas the inferior vena cava brings the blood through the lower part and trunk of the body into the right atrium. So these are 2 openings within the right atrium, plus there is a coronary sinus opening. The coronary sinus bring the blood returning from the wall itself, cardiac wall. This wall of the heart is also supplied by the blood. So return of this wall of the heart, not valve, wall, heart wall. So this returning blood from heart itself, or wall of the myocardium itself, it is returned to the right side of the heart or the right atrium via the coronary vessels, and these are opening through the opening within the right atrium is the coronary sinus. Then blood comes into the right ventricle, and then into the pulmonary trunk, then right and left pulmonary arteries, and then into the lungs. And then after this whole blood which is returning from the body, it is poorly oxygenated, because all the blood which goes through the arterial side, it is rich in the oxygen, and it supplies the oxygen to the body tissue and nutrients to the body tissue at every level of the body. And then at the capillary level, all the oxygenated blood is supplying the nutrients and oxygen to the body tissue, and poorly nutrient and purely oxygenated blood is returned back through the venous side and into the major veins like superior inferior vena cava, and then wall of the heart or myocardium itself via the coronary sinus. They open into the left side of the heart, right side of the heart, and then to the right ventricle, right atrium, right ventricle, then pulmonary trunk, then right and left pulmonary arteries. Now there is a confusion. Students are always confused why there is a inverse. We are the vessels which are taking deoxygenated blood, we are calling it as a arteries, and blood vessels which are bringing like oxygenated blood, we are calling them pulmonary veins. So why it is so? This is very simple, because the definition of an artery and vein is like the vessel which takes blood away from the heart is called as an artery. The vessel which brings blood back to the heart is called as a vein. So as you know, this pulmonary blood through the right heart goes through the pulmonary trunk. It's going away from the heart. It is going for the purpose of the filtration, no doubt, but is again going away from the heart. That is why we are calling these are the pulmonary arteries. And when this blood is get filtered within the alveolar level within the lung, and it is returned back onto the pulmonary to the heart. Now this blood which is coming back to the heart is called as a pulmonary veins, because all throughout the body the blood is returning to the heart via the veins and going away from the heart via the aorta, right? So the going away from the heart is the artery, coming back to the heart is the vein. So that is why it is vice versa over here, because from the right heart blood is going away, from the left heart on the left side it is coming back, right, from the lungs. So that is why these are called as a pulmonary veins and these are called as a pulmonary arteries. Otherwise rest of the body, the deoxygenated carrying vessels are called as a pulmonary veins and oxygenated blood carrying vessels are called as a pulmonary arteries. I hope we are clear. And then this blood which is getting oxygenated from the lungs, and then through the pulmonary veins it will enter onto the left atrium of the heart, and then from the left atrium of the heart it will go onto the right ventricle of the heart. From the right ventricle of the heart it will go within the ascending aorta by passing through the aortic valve and then arch of aorta, and then ascending aorta and then arch of aorta and then thoracic aorta or descending aorta, abdominal aorta, then lower limb. So throughout the body, and also from the arch of aorta the major vessels which emerges, which supplies the head and neck and upper limb and thorax. So this is how the flow of the blood occur on the left side and as well as on the right side. As on the right side you already know, but now this is the right side of the heart and this is the left side of the heart. This is the interventricular septum and this is the right atrium, this is the right ventricle, and this is the right AV valve, this is the left AV valve, this is the left atrium, and this is the left ventricle. The left ventricle is more cylindrical. Interventricular septum is more dilated, or you can say convex towards the right side. And the wall of the right side, left side is 3 times thicker than the left side. The reason why the right side heart is thinner and why the left side wall is thicker, because the blood which is going from the left ventricle to the pulmonary vessels, as we already know, the pulmonary vessels is a less pressure, like it is 25 millimeter of mercury within the pulmonary veins or blood within the pulmonary vessels, and the blood in the systemic vessels there is a pressure is 120 millimeter of mercury. So there is more force applied on the left side as compared to onto the right side, because it has to push in the low pressure vessels and the left side has to push the blood towards the high pressure vessels. So that is why the workload of the left side is greater and the wall of the left side is more thicker, 3 times thicker than the right side of the heart. Now you can see these are the tricuspid valves, these are the 2 bicuspid valves. As the contraction of the relaxation of the right atrium, let the right atrium fill the blood, receive the blood from 3 sources like superior and inferior vena cava plus coronary sinus, and then contraction of these allow these pressure allow these valves to open and all the blood enters into the right ventricle, and while right ventricle, when receive blood, it is relaxed, right? And when it's completely filled, the pressure backward will close this valve and pressure backward will open the pulmonary valve. As the pressure builds and blood reaches up till the pulmonary valve, the pressure will hit this wall and this wall will open upside and this blood will leave the right ventricle, enter into the pulmonary trunk, then right and left pulmonary arteries, and then into the lungs. And then from the lung, when blood come back or return back to the left atrium, when the left atrium is receiving blood, it is relaxed. It is not contracted. It is dilated. So it is receiving all the blood. When it is completely filled, pressure built within the left atrium and it pushes this valve downward and blood will enter into the right or left ventricle. Now when the blood is this is the relaxed position within microseconds. So that is the filling time. When it contracts, it's empty time. It is pushing upward. So when it is relaxed, all the blood is coming down from the left atrium into the left ventricle. When it is completely filled, the pressure will, when pressure build within the left ventricle, it push these valve and keep them closed. Where the pressure will reach up till the blood will reach up till the pulmonary valve, the pressure is built and push the pulmonary valve, aortic valve to open, and then blood will leave from the left ventricle and enter into the ascending aorta, and then arch of aorta, then major vessels of the arch of aorta, then thoracic aorta or descending aorta, then abdominal, and then two major right and left iliac arteries, and then lower limb, etc. So this is how throughout the blood is circulating within the cardiovascular system. The heart is dilated blood vessels with thicker muscular wall. As you can see, if these valves are not guarded with the fibrous ring, the opening cannot remain patent or constant in their shape. So because they are muscular wall or muscular pump, and it has a skeleton, that is the fibrous skeleton, that is called as a fibrous ring of the heart or fibrous skeleton of the heart. And then these rings are attachment of these valves within these rings. So there are one bicuspid valve and three are the tricuspid valve. Pulmonary, aortic and right AV valve are the tricuspid, whereas the left AV valve is the bicuspid valve. Now, internal features of the chambers and valves of the left side of the heart. Left atrium. The left atrium forms most of the base of the heart. As you can see, this is the apex of the heart, right? And this is the base of the heart. This highlighted in green is the left atrium. So, majority of the base of the heart is formed by the left atrium, right? You can see this is the left atrium and this is the left atrium. So, left atrium form most of the base of the heart. Valveless pair of right and left pulmonary veins enter the smooth-walled left atrium. As you can see, this is the left atrium. It is a two valve of two sides, the posterior side or posterior wall which is smooth, and this is the anterior side which has been removed, but part of this you can see this is rough due to the presence of pectinate muscle. So this is rough anterior wall, similarly like on the right side. And posterior smooth wall, this is the posterior smooth wall and this is the anterior rough wall, right? So it receives two pair of veins, pulmonary veins, which are not attached with the valve. They are valveless veins. On the two on the right side, two on the left side. As you can see, these are the two left pulmonary veins, superior and inferior, and two right pulmonary veins, superior and inferior, right? So these are the valveless pair of right and left pulmonary veins enter the small walled left atrium. Now smooth walled left atrium receives, or posterior wall of the left atrium receives two pair of the veins, which are the pulmonary veins, right and left, superior and inferior. On the right side there is a superior and inferior vein, and left side superior and inferior vein. So these veins are coming back from the lungs and bringing blood which is oxygenated, right? So it enter into the left atrium. So all the blood within the left atrium is actually coming through these pulmonary veins. Why they are calling the veins? Because they are coming back to the heart. The vessel which is going away from the heart is called as an artery. The vessel which is coming back to the heart is called as a vein. Now the two walls, like this is the external view. Again external view, this is the atrium. Left atrium, this is the left atrium, this is the right atrium, and here you can see this is the right atrium, superior and inferior vena cava. This is the arch of aorta, pulmonary trunk, right and left pulmonary arteries, and you can see this is the superior and inferior right pulmonary veins, superior and inferior left pulmonary veins. So there are two pair of veins which open within the posterior wall. This is the posterior view, right? So open within the posterior smooth wall of the left atrium. Posterior half or smooth wall or inflow portion. The posterior part of the left atrium also called as the posterior half or smooth wall or inflow portion. Inflow portion because it is getting flow from the blood flow from the outside. So it is an inflow portion sort of. Receive 4 pulmonary veins, 2 superior and 2 inferior on the right and left side both. Now anterior half is continuous with the left auricle. This is the anterior half which is removed partly, which is continuous with the left auricle. Similarly like the right auricle, this is the extra extension of the left ventricle, which is tongue-like projection or ear-like projection, and it overlaps the pulmonary trunk. You can see this is the pulmonary trunk. So that is why this is called as an auricle, because it is a ear-like projection. And this is the common site for the thrombosis. Unlike the crista terminalis in the right atrium, there is no line of demarcation in between the smooth and a rough wall. Like in the right side, there is a line of demarcation in between a smooth and rough wall of the chamber of the heart. Inside, there is a crista terminalis. So there is no line of demarcation. So unlike crista terminalis in the right side, or right atrium, no distinct structure separate two components of the left atrium. So there is no line of demarcation or no distinct structure which separates these two. But there are pectinate muscle present on the anterior wall. That is why it is called as a rough. And there is no pectinate muscle on the posterior side. So that is why these are the smooth. Now you can see this is the right ventricle, or left ventricle, right ventricle posteriorly. Now this is the right atrium. This is the superior and this is the inferior pulmonary veins, and here again pulmonary vein opening. And here you can see this is the posterior smooth wall, and this is the flip which is taken by this hand. This flip is the anterior wall. So this is the anterior wall, this is the posterior wall. This is the left atrium. This is the vena cava. In fact, this is the arch of aorta, not vena cava. You can see the major vessels are arising from it. Again, a left AV orifice through which the left atrium discharge oxygenated blood into the left ventricle. Now this is the left atrium which receive blood through the pulmonary veins from the heart. So this oxygenated blood reaches into the left atrium, and then through this AV orifice, left AV orifice, blood enters into the left ventricle, and then from the left ventricle it will go up. There is an opening for the aortic arch of aorta, that is the aortic valve, and then it leaves the left side of the heart. So a left AV orifice through which the left atrium discharge oxygenated blood into the left atrium received from the pulmonary veins, two paired pulmonary veins. Left auricle, tubular muscular left auricle, its wall trabeculated with pectinate muscle. So pectinate muscle is trabeculated on the anterior side and also auricle. That is why this is a rough part and this is smooth part, because there are no trabeculae. So the pectinate muscle is trabeculated over here. So that is why this is the rough part and this is the smooth part. So auricle is also more rough part of the chamber of this heart. This chamber of the heart, tubular muscular left auricle, its wall trabeculated with the pectinate muscle. It forms the superior part of the border of the heart and overlaps the root of the pulmonary trunk. It forms the superior part of the left border of the heart, right? Now this is the right border of the heart, this one. This is the left border of the heart. This green is the left auricle. So you can see the left border, the superior part of the left border is formed by the left auricle. And left auricle is also overlap the root of the pulmonary trunk. This is the pulmonary trunk. Right, root of the pulmonary trunk is overlapped by this auricle, and this auricle forms the superior part of the left border of the heart. This is the right border of the heart. This is the left border of the heart. This is the diaphragmatic border of the heart, and this is the left pulmonary surface. This is the right pulmonary surface, left pulmonary surface, anterior surface, and this is the diaphragmatic surface. So the left border of the heart is superiorly formed by the left auricle. So it forms the superior part of the left border of the heart and overlaps the root of the pulmonary trunk. This is the root of the pulmonary trunk and this is the left auricle. Fossa ovalis, a semilunar depression in the interatrial septum in between two atria. This is the fossa ovalis, indicates the floor of the oval fossa. So foramen that allows the blood to shunt between two atria during the embryonic development. During the development it is open, that is why it is called as a foramen, but immediately after birth it closes because the lungs are functioning now. So that is why it is called as a fossa ovalis. So this is the remnant of the foramen ovale, which allows the shunt in between two atria during the embryonic life. But if it persists, it is called as a PDA, patent ductus arteriosus, PDA, which is the congenital disease in which this foramen does not close and surgically corrected afterwards. And this is the semilunar depression. As you can see, this is the semilunar depression on the left side. And this is the fossa ovalis. Left ventricle. The left ventricle forms the apex of the heart. You can see the apex of the heart is formed by the left ventricle. This is the, not base, but apex of the heart. This is the apex of the heart. This is the base of the heart. The base of the heart is mainly formed by the left atrium. And the apex of the heart is formed by the left ventricle. Anterior wall is mainly formed by the right ventricle. Left border is mainly formed by the right atrium. Diaphragmatic surface is mainly formed by the left ventricle. This ventricle is coming downward and the majority of the diaphragmatic surface is formed by the left atrium. But the anterior surface is formed by the right atrium. The left ventricle forms the apex of the heart. This is the apex of the heart. This apex of the heart is formed by the left atrium. This whole is the left atrium. This is the left ventricle, and this is the right ventricle. Nearly all its left pulmonary surface and border and most of the diaphragmatic surface. So left pulmonary border, left pulmonary surface and diaphragmatic surface are formed by the left ventricle. The superior left border superiorly formed by the left auricle. The base of the heart is formed mainly by the left atrium. The right side, right border or the right pulmonary surface is mainly formed by the right atrium. Anterior surface is mainly formed by the right ventricle. Now here you can see this is the left pulmonary border formed by the left ventricle, even the left pulmonary surface formed by the left ventricle, and the diaphragmatic surface is formed by the left ventricle. As you can see, this is the diaphragmatic surface, this is the left side, so this is the again left side, this is the right side, and this is the apex of the heart, and this is the diaphragmatic surface inferiorly, which is formed by the, this hole is the left ventricle, this is the right ventricle, this is the right atrium above. In fact, this is the right atrium, but the right ventricle is up till here behind this flap, and this inferior surface is the left atrium or left ventricle. Now left ventricle perform more work than the right ventricle. As we already know, it has to push the blood against the high pressure blood vessels. Like on the systemic circulation, there is a 120 millimeter of mercury pressure. On the pulmonary vessels, there is a 25 millimeter of mercury pressure होता है. So that is reason the wall of the left side of the heart is 3 times thicker than the right side of the heart, because it has to push blood against the high pressure vessels towards the systemic vessels. It has to push blood towards the pulmonary vessels, and the atria both are very thin because they only have to push blood down on the floor, just one floor down. It has to push the blood one floor down, but this has to push blood throughout the systemic circulation against the high pressure, and it has to push the blood towards the pulmonary circulation against comparatively low pressure. So that is why the atria has the thinnest wall and the left ventricle has the thickest. It has the thickest wall because atrial pressure is much higher in the systemic than in the pulmonary circulation. Now walls are walls that are 2 or 3 times as thick as the right ventricle. The wall of the left ventricle is 2 to 3 times thicker than the right ventricle. Trabeculae carni that are finer and more numerous than those of the right ventricle. Trabeculae carni which are more fine or more thin and more numerous on the left side as compared to onto the right side. Conical cavity that is longer than that of the right ventricle. So this is conical and more elongated and wider as compared to the right ventricle, because this intermuscular septum is more bulged towards the right side because of the pressure within the left side is more. So this is more cylindrical or more concave, and this is a more like convex because of the convexity of the this intermuscular septum. Now anterior and posterior papillary muscles that are larger than those of the right ventricle. Right ventricle has anterior, posterior and medial papillary muscle, because this valve is tricuspid. That is why there are 3 muscles: medial, anterior and posterior. Here are the anterior lateral and posterior medial, right? So there are 2 muscles, but they are more thicker and larger as compared to the right side. The smooth wall superior anterior outflow part. This is the superior anterior outflow part, which is called as a aortic vestibule. This is the aortic vestibule. This is the outflow part. The inflow part, which is rough because it produces friction. As the blood comes down, it will not flush back towards the atrium again. So that is why it is rough. So it produces friction. But outflow is smooth. It should go smoothly. It should not come back. So that is why outflow part is smooth. So a smooth wall superior anterior. This is the superiorly, and as you can see anteriorly, more anteriorly. Superior anterior. This side is the more posterior and this is more anterior, and this is superior. Smooth superior anterior outflow part is called as the aortic vestibule, leading to the aortic orifice and aortic valve. It will lead to the aortic orifice and then aortic valve through the aortic valve it will enter into the ascending aorta, then arch of aorta, then it will go into the major vessels and descending or thoracic aorta, abdominal aorta, etc. Now a double leaflet mitral valve guard left AV orifice. Now double leaflet, as we already know, it has two leaflets. This is the only valve which is a two leaflets. Rest of them are tricuspid. They have three leaflet, like 1, 2, 3, 1, 2, 3, and even in this there are three leaflets. So the double leaflet mitral valve guard the left AV orifice, the AV orifice or AV opening in between the atria and ventricle on the left side, which is guarded by the double leaflet mitral valve. The aortic orifice lie in its right posterior superior part, right? So the aortic orifice lies at the superior posterior part. It is more towards the posteriorly and superiorly, or at the roof on posteriorly side. This is more anterior, this is more posterior, right? So the aortic orifice lie in its right posterior superior. Now this is the left side, this is the right side within the right ventricle. So left side and more anterior is the mitral valve, right? And on the left side and more posterior as compared to this is posterior. So this aortic valve is posterior and on the right side. So aortic orifice lie in its right posterior superior part, surrounded by a fibrous ring, which right and posterior ring to right and posterior वो same बात है कि right side पे है और posterior है as compared to the mitral valve. And left cusps of the aortic valve are attached. Posterior and left cusps of the aortic valve are attached, and ascending aorta begins at the aortic orifice. Simple is that mitral valve is more anterior as compared to the aortic valve, and mitral valve is on the left side and aortic valve on the right side, and this is more posterior. This is tricuspid, this is bicuspid. This will lead to the left and ventricle. This will lead to the ascending aorta. Again same. This is the tricuspid and this is the ascending aorta. This is the arch of aorta. This is more on the right side or left side. This is on the right side, and this is more anterior. This is more superior. This is the outflow part, which is smooth. This is the inflow part, which is rough. Mitral valve has two cusps. It has two cusps, anterior and posterior. As you can see, this is the anterior cusp and this is the posterior cusp. This is the aortic valve, it has a three cusps. This is the pulmonary valve, it has three cusps. This is the right AV valve, that is the tricuspid valve, it has a three cusps. Located posterior to the sternum, it is located just posterior to the sternum, right, at the level of fourth costal cartilage. So this is the like surface anatomy sort of thing. It will help you in that. Each of its cusps receive tendinous cords from more than one papillary muscle. Now you can see more than one papillary muscle, they receive the tendinous cord. These tendinous cords are called as a chorda tendini. Chorda tendini because these are the connective tissue cords and these are cord-like tendons, so that is why these are called as a chorda tendini. The chorda tendini are attached to two leaflets of the valve, and they come down and attach at the apex of these papillary muscles. The papillary muscles are projecting inside the lumen of the ventricles, and their base is attached to the myocardium, and apex is free, which is receiving attachment of this chorda tendini. Upon contraction of this papillary muscle will allow the opening this valve, and relaxation of this muscle will allow the closing of this valve. Oh, sorry, vice versa. Contraction of these will allow the closure, and relaxation of these allow the opening of this. Sorry, give me just 1 minute. The contraction of this muscle as they contract, they will pull the valve down and they will shut the valve. When they are relaxed, they will leave this chorda tendineae relaxed and valve will open up, right? So each of its cusps receive the tendinous cord from more than one papillary muscles. There are two papillary muscles main, but they are more like anterior and anterolateral. And here you can see this bicuspid valve is called, why it is called as a mitral valve, because it is taken from the bishop mitre. The bishop mitre is a cap. You can see this is sort of bicuspid. Bishop means like governor of church is called bishop, and it wears the mitre. The mitre is called to the, actually it is a Greek word that means mitre means crown. So this is the like what a governor of the church. So governor is church is the leader sort of thing. So it has to wear crown. So that is why the cap which is worn by this church governor is called bishop mitre. So because it looks like this bishop mitre, so that is why it is called as a mitral valve. It is bicuspid and it look like this. So what is the history behind this mitral valve? It is taken from the bishop mitre. Mitre is a word, a Greek word that means the crown. Mitre. So bishop mitre. This is the mitral valve. Now here you can see this is the papillary muscle, right? And this is the left ventricle. These are the chorda tendineae. And this is more thicker than the muscle which are, these are the what? Ridges, or you can say these are the inflow part which is rough, right? And this is the papillary muscle, this hole. These are the tendinous cords are attached to these leaflets. These are the leaflets, these are the cords, right? This is one, this is the second. This is the left ventricle. This is the inflow rough part. Here will be the outflow smooth part. Now muscle and their cords support mitral valve, right? Muscles and their cords, these are the papillary muscles, and their cords, these are the chorda tendineae, support the mitral valve, allowing cusp to resist pressure developed during the contraction of the left ventricle. So with the help of this muscle and these chorda tendineae, these valve resist pressure during the contraction of the left ventricle, because left ventricle will forcefully contract. So it cannot regurgitate back, or these valve cannot go back inside the atrium, right atrium, because due to pressure, as this muscle will forcefully contract, they can go back. So inversion of these valve within the left atrium, the blood can go back. So they are held by these. Upon contraction of these, they keep the shut valves close. And because the pulmonary valve does not have any chorda tendineae or attachment of the papillary muscle, as the pressure develops, it pushes the valve towards the pulmonary ascending aorta, and then this blood leaves the left ventricle and enter into the ascending aorta. So subvalvular apparatus. What is subvalvular apparatus? Subvalvular apparatus is these chorda tendineae and papillary muscles. They are under this valve. So this called as a subvalvular apparatus. इसमें BCQ आता है कि subvalvular apparatus किसको कहते हैं. So the subvalvular apparatus are the papillary muscles, and these chorda tendineae are called as a subvalvular apparatus. Again, this is the same, nothing to explain in this. Aortic valve, each of three semilunar cusps of the aortic valve, posterior, right and left. As you can see, this is posterior, this is left, and this is right. So posterior right and left and right cusps. There are three cusps, but there is no, you can see in these both, there is no chorda tendineae or papillary muscle. This is the right side, there are three papillary muscles. There are left side two papillary muscles, anterior and posterior cusp, and this is the fibrous ring. Now each of the three semilunar cusps of the aortic valve, posterior, right and left. So this is posterior, this is right, and this is left cusp, and is concave when viewed superiorly. If you view them superiorly, they are sort of concave. You can see this is the concavity. If we see the superior view, remove these atria and vessels, these valve will be concave superiorly. They are bulging inside the left ventricle, right? So when the pressure built within the left ventricle, a left ventricle contracts. So there is a support to the mitral valve to not open, but there is no support. So push of or pressure developed within the left ventricle will push this valve inside the ascending aorta, and blood will leave the left ventricle and enter into the ascending aorta. The semilunar cusps do not have a tendinous cords or support to support them. Smaller in area than cusp of the AV valve. As compared to the AV valve, you can see these are the smaller, and force exerted on them is less than the tricuspid and mitral valve. So the force exerted on them is as compared to less as these AV valves. Now you can see this is the left ventricle, and these are the papillary muscles, right? So this is the anterior medial, this is the posterior anterior lateral, this is the posterior medial. Now this is the magnified over here, this is the papillary muscle. You must be thinking why this blood has become like white, not red, but this is the preservative, which is for the preservation of this tissue. Quiz. Blood enter into the heart because of the muscles of atria relaxation, ventricular contraction, ventricle relax or atria contracts. Means when the blood enter into the heart, what happens? At which stage the blood enter into the heart? During the atrial relaxation, ventricular contraction, ventricular relaxation or atrial contraction? Quiz number 2. Which of the following valve is atrioventricular valve? Mitral and pulmonary, tricuspid and pulmonary, mitral and tricuspid, mitral and aortic. Which is the bicuspid valve? Mitral, aortic, tricuspid or pulmonary? Clinical. Mitral valve disease. Incompetence. Incompetence means insufficiency of the valve which results from the poorly function of the valve. Means it cannot completely close. It is insufficiency of the valve which does not completely close. Incompetence occur mainly due to the papillary muscle ischemia or damage due to the ischemia, or any like injury to the chorda tendineae. Then stenosis, narrowing of the orifice, caused by the valve inability to open. So valve become more rigid, they cannot completely open, so blood is not fully go easily from the atria to the ventricles. So stenosis means narrowing, incompetence means insufficiency. Means ये एक तरह से आप देख लें कि ये दरवाजा completely easily खुल जाता है, जिसको कोई फोर्स नहीं है, इजीली खुल जाता है. ये दरवाजा कंप्लीटली नहीं खुल रहा, या ये कह कि ये दरवाजा कंप्लीटली बंद नहीं होता, ये कंप्लीटली खुलता नहीं है, राइट? सो इनकॉम्पिटेंस, insufficiency which results from the poorly functioning valve. It can result from the papillary muscle injury due to the ischemia maybe, and then it will not completely like allow the hold the chorda tendineae to keep the shut valves. And stenosis means narrowing of the valve. It can be because of the calcification, right? So it become more rigid, they are not opening completely. So both stenosis and incompetence lead to the poorly functioning valve and subsequent heart changes. Which changes can occur? Number 1, left ventricular hypertrophy. Force बढ़ेगा, pressure बढ़ेगा. Left ventricle has to work hard. So left ventricular hypertrophy, increased pulmonary venous pressure. Increased pulmonary venous pressure, backward flow बढ़ जाएगा. Pulmonary edema हो जाएगा. Backward flow बढ़ेगा. Definitely within the lungs there is the congestion of the blood, and then pulmonary edema, seepage of the blood out of the vessels, pulmonary edema, or enlargement or dilatation and hypertrophy of the left atrium. If the left ventricle is working hard for longer time of period, the problem is not fixed, then continuous overworkload will lead to the hypertrophy, means increase in the size of the left atrium and left ventricle. So enlargement or dilatation and hypertrophy of the left atrium and left ventricle. This will lead to the hypertrophy of the left atrium, because this is the stenosis of the mitral valve, not the pulmonary valve, right? So then aortic stenosis refers to the narrowing of the aortic valve. Now you can see this is the aortic valve. Now this may be calcification which is not completely letting this valve open. This is the annular ring. These are the valves, tricuspid valve, but they are not completely open. This is the fibrous ring. Now refers to the narrowing of the aortic valve. Restriction flow of the blood leaving heart, means left ventricle is not completely easily emptying. Main 3 causes: age related calcification, over age हो जाती है, then normally calcification slowly starts within these valve, plus congenital defect. Any like a congenital defect may lead to the stenosis of the aortic valve, and rheumatic fever. Rheumatic fever is most common acquired cause of the aortic stenosis, and this aortic stenosis may lead to the left ventricular hypertrophy.